morning, everybody. My name is Jem Lee, and I'm a research scientist at the Cancer Prevention Institute of California. We're based right across the Dumbarton Bridge, if you're familiar with the Bay Area in Fremont. And I'm also a consulting assistant professor here at Stanford University. So today, I will be talking to you about a pilot study that we've been conducting at CPIC in collaboration with Stanford. Actually, this is my first time at a Stanford Medicine X conference, so I wasn't quite sure what to expect in terms of a lot of numbers I'm presenting, but if there's any questions that maybe non-research scientists have, just feel free to stop me anytime. So, and also just a little bit about myself. I'm trained as a social epidemiologist, so I'm very interested in the social environment and health outcomes. And my particular area of interest has always been around social networking, both originally in-person networking, now moving towards online networking, and looking at the relationship between that and how it affects outcomes, health outcomes. So this pilot study, it's the right arrow, okay? So we are focused on breast cancer survivors, at least my area of specialty at CPIC. And this is a graph showing, a pie chart showing the distribution of the estimated number of cancer patients and survivors in the US as of 2012. So this is the latest data. As you can see, 22% of all cancer survivors are breast cancer patients or survivors. And I use both terms because I think people prefer, there's no consensus on what term to use, so I'm going to use both terms. It is the largest proportion of cancer survivors in the US. This chart also shows the projected number of cancer survivors we expect to see in the US. And as you can see, this is all cancer. I couldn't find one just for breast cancer, but it's the same growing trend that we're seeing with the population in the US. As the population continues to age, we are seeing more cancer, and we are seeing more cancer survivors also, especially for the ones with very high survival rates. And this is only going to continue to increase in the future. Now, just looking at breast cancer, just to give you a sense of what the breast cancer survivor patient population looks like in the US, this is the estimated number of survivors as of 2012. And this is a statistic showing the 5-year survival rate right now for all breast cancer patients and survivors at 88.9%. So it's one of those cancers that it has a very high survival rate. The median age of diagnosis is about 61. And then the prevalence by years since diagnosis. So we see a lot of newly diagnosed patients. That's the orange bar of less than 1 year. That's usually the period where most women go through a diagnosis and finish their treatment in the first year. The red segments of that are the 1 to 5 year survivors. And then, as you can see, the majority of breast cancer survivors constitute about 70% of all breast cancer survivors and patients who are at least 5 years out from diagnosis. And for a majority of these women, they are pretty much done with treatment, even endocrine therapy. But they are still being monitored, and after this phase, there's a lot of gap in the research literature now in breast cancer survivorship studies of what's next for them, because they still continue to experience a lot of distress and problems resulting from their breast cancer diagnosis, even after 5 years. So this is all to set you up to make the point that cancer survivorship needs are a growing public health priority. Just in the last 30 years, as I've shown, the 5-year survival rate has increased from 74.9% to about 88%. Oh, I'm sorry, I didn't put in the reference. I should have checked that, but it was the same reference as before. And as the active treatment, again, is usually within the first 12 months, and that would constitute usually chemo, radiation, or surgery, depending on the stage, the extent of disease, and the preference of the patient as well. So, but post-active treatment, after that initial treatment is finished, usually consists of endocrine therapy, such as tamoxifen, which women are often on for 5 years at least. So during this time, they can experience psychosocial distress, fears of cancer recurrence, and second cancers. Once you have breast cancer, you are at risk for getting diagnosed with a second type of cancer, ovarian cancer or some other cancer. There are also issues with side effects and symptom management, and also prevention of increased health risks, such as osteoporosis. So women who are diagnosed with breast cancer are also at higher risk for other chronic conditions as well, and clinical conditions. So the problem that we are facing now is that women who are out of treatment for breast cancer still experience distress and have needs for follow-up care and support. However, we are just scratching the surface of how to deal with that problem. And why do we care? So there is actually a name that has been, coined coming out of the NIH about this segment of cancer survivors, those who have finished treatment. This is the transition from active treatment to post-treatment care, and it's been identified as a critical area that warrants further research to identify unmet needs and interventions to support breast cancer survivors. And there was a report that was issued out by the NIH about, I'd say 5 years ago, and it was called Lost in Transition for this segment of the cancer survivor population, playing on the movie title Lost in Translation. But it is a lost in transition phase because it's always the question of what's next, what kind of support will I get? I'm not seeing my doctors as often anymore. So this led me, being a huge social media enthusiast and avid user, the question of how social networking sites can play a role in the health of out-of-treatment breast cancer survivors. This is just a formal definition that social networking sites function primarily for individuals to maintain, form, and visualize their social networks. So I put up this formal definition to differentiate from what we've seen with Web 1.0 before with listservs and forums and things like that. This is really modeled after the Facebook social networking model, where you actually go into a website, a social networking website, where you can actually connect to people. And it's very different from what we've seen before in the 90s with the listservs. So, through internet support. And social networking sites actually offer a convenient way to obtain information and emotional support from peers, particularly during times of uncertainty and stress. And as we all know, I don't have to say and preach this to the choir, it's a rapidly growing part of the online experience with enormous under-tapped potential for health promotion. I think with conferences like this, I think we're starting to build a momentum of how can social networking sites play a role in that. But it's still, at least for cancer survivors, it's still very much under-tapped in terms of how we can use it to support survivors. The advantages of that are if we can prove it's effective, it can cost efficiently maximize reach to the target population of internet users. Obviously, to have access to a social networking site, you need to be an internet user. And also, there are lots of different social networking sites on there. There are the mainstream ones that most of the public is familiar with, such as Facebook and Twitter. Those are not disease-specific, although they have some disease-specific pages within them. But there are now, in the last few years especially, cropping up these new disease-specific social networking sites. And some are very broad, targeting all patients who are suffering any type of chronic disease, patients like me, smartpatients.com. But then there are also very specific social networking sites just for that particular disease. So one example I want to give is MyPCT. And this is a web page profile from, and God bless Helen, she let me share this with the group today. But Helen Chen was a project coordinator for this study, and she was diagnosed with breast cancer at age 28, and that prompted her to work at CPIC. And she was such a great, talk about patient engagement and being in research. She was such a huge asset to our pilot study. But this is her MyPCT webpage. And I'm not in any way endorsing MyPCT or selling it, but this is just an example of a social networking site that's disease specific. And what's interesting is that when I actually went out to meet the CEO of, it's actually part of myhealthteams.com, and they actually put out disease specific sites. They did my autism team, they did my MS team, and they did my BC team. But when I went out to meet the CEO of My Health Teams who did this site, they were very protective of this site. They don't want researchers on it. They don't want anyone who doesn't have breast cancer on it. It's very much protected for women with breast cancer. So this is a sample page of Helen's page. She's 30 years old now. Well, last year she was. So trends in social networking site use. I don't think I have to, again, preach to the choir about this, but trends are going up in all age categories, some more rapid than others. But this is a good sign that I think this is really a sign of the times that we need to respond to the trends that are out there, and how can we leverage this and intersect this with health. And this is from the Pew Internet data, of course. So this is all background and setup for the current study I'll be talking about. It's a pilot study that's in progress, so I'll actually only be presenting one portion of the study today. It was a mixed method study using qualitative and quantitative data to assess use and influence of social networking sites in breast cancer survivors. So we had two specific aims, but the specific aim I'll be addressing today, because we're still working on aim 2 analysis, is the qualitative data part, which this was a patient context study. 3 minutes. Okay, I'll try to zip through this quickly. I won't read this, but this was really our aim, was to identify motivators and barriers, information and value of social networking sites. This was our eligibility criteria. We did focus group interviews. We went through the whole qualitative analysis rigor of transcribing using grounded theory, using deduced qualitative analysis software and coding. So I'll skip through that. This is a slide showing our participant characteristics. We really set out to look at racial ethnic differences to see if there are differences in terms of use. And so we sampled by that. We didn't get, because it was only English speaking, we didn't get a lot of Asians and Hispanic women, unfortunately. So it's a pretty diverse population. We looked at users and non-users. And for the results, I just want to briefly outline the 3 main themes that we found from the qualitative portion of the study. One for social networking site users, one for non-users, and one cutting across all participants in the aim 1 work. So theme 1, we found that breast cancer survivors have a strong desire to build, be a part of, and give back to the community. This was a theme that really resonated over and over and over again. And the quotes that I saw that I wanted to highlight is really, I won't read all of it, and maybe a few snippets, but there is this feeling that people just don't understand what they're going through, even if they sympathize. So I think we hear it all the time here, again, with the e-patients. And this was a way for them to connect with other people who were going through the same thing. And the other part of this is that these women also wanted to give back to the community because they were out of treatment. They really wanted to share their experience in providing support to those who are newly diagnosed. For theme 2, for non-users, this was interesting. There were 2 sub-themes I noticed. There was the lack of awareness of the existence and functionality of social networking sites for the patient community. And I think for this, among non-users, even though they were very active internet users, there was this taboo around using social networking sites and a lot of fears around that. There was a lot of strong anti-social networking site attitudes and negative perceptions based on their use with Facebook, mainly. It was seen basically as a source of gossip. So that's why they really did not want to use it. Another sub-theme is that they did not want to be reminded of their disease, nor do they want to construct their identity based solely on their breast cancer status. And there's more to that, but unfortunately with the limited time, I'll have to zip through the next one. So there was also another cross-cutting theme across both non-users and users, in that there appears to be very polarizing attitudes around the use of social networking sites for health. The attitudes and use or lack of use were largely driven by intrinsic personality traits rather than by cultural norms related to health-seeking behaviors and possibly introversion-extroversion traits. I can go on and talk about this in depth for a long time. I found this really fascinating because we set out to look at racial ethnic differences and cultural differences. And we found that even within African American women, there were women, African American women who loved it and women who didn't love it. And it was really just the personality traits that came out of whether or not they wanted to share or wanted to be more private. And so these are some quotes illustrating.
During the question time.
I'm in the question time now. Okay. So I won't read all of this, but I will read the purple, which I think highlights some of these personality traits that come across. One Latina breast cancer survivor, who's a non-user, says, I guess I'm just more quiet about it than some people who need to have this. Another non-Hispanic white social networking site user uses it because it's validating and vindicating an incredibly important thing in my life. And for her, she actually was so much of a people pleaser. This quote just showed that, you know, she couldn't respond to all the needs of everybody in her life. And when she went to her social networking support system, they told her it's okay, you can't respond to all of this. You don't need to. We're here to support you. You know, it was validating to her that she didn't need to be this people pleaser to people in her real life. And so this illustrates a potential gap in overcoming the barriers for using social networking sites for the patient community. And one of the participants was, you know, really she had this great idea because a lot of women didn't want to use the sites because of just not being reminded by their disease, but they still looked at it as a source for support. And this was her suggestion. I wonder if there's a website that anyone has started. Okay, this is for cancer patients, but we are not going to discuss the cancer. We're going to discuss the positive things we've done today or last week. You know what? What did you do? I had a weekend at Great America. Doesn't that sound good? And I think when you go onto these social networking sites, you do see a lot of, we had people who demo the sites and they literally, after 2 minutes, didn't want to hear the sad stories on the sites, but they did want the support. And then just pilot study strengths. This is a pilot study, so it's still very exploratory. I think one of the key things is that we really try to look across ethnic groups, and that's really important to us in terms of understanding health disparities. Next steps is to analyze the quantitative online survey data. We do want to test the hypothesis of whether or not using social networking sites improves quality of life among breast cancer survivors. We were invited to develop this into a full manuscript for PLOS One. We want to leverage these pilot findings to develop more robust studies to add to the evidence base. And I will end on that note. 30,000-foot view for me in terms of questions from the pilot. Ultimately, and I just tweeted this yesterday, based on the talk, how do we safely integrate social networking sites into our care? This is another story that I can share later in the questions section. And this is our study team.